I always tell my patients, don't ever let anyone gaslight you into thinking that, your symptoms are normal because you know your body better than anybody else. And if you think something is wrong, most oftentimes there usually is.
Welcome to the Dutch Podcast, where we dive deep into the science of hormones, wellness, and personalized healthcare. I'm Dr. Jaclyn Smeaton, Chief Medical Officer at Dutch. Join us every Tuesday as we bring you expert insights, cutting-edge research, and practical tips to help you take control of your health from the inside out. Whether you're a healthcare professional or simply looking to optimize your own well-being, we've got you covered. The contents of this podcast are for educational and informational purposes only. This information is not to be interpreted or mistaken for medical advice. Consult your healthcare provider for medical advice, diagnosis, and treatment. Hi there, and welcome to this week's episode of the Dutch Podcast. On this week's episode, we are going to talk about something that, if it's ever happened to you, you know how distressing it can be, and that's hair loss for men and for women. Now, hair loss, while you might get an initial workup with your primary care doctor or your OBGYN or even see a dermatologist, the scope of what gets evaluated, number one, is usually pretty narrow. And I find that most patients are sent away saying, everything looks fine. Everything's going to be fine. This is telogen effluvium or it's temporary. Just let it pass. But it's really hard to sit back and trust that it will pass. And oftentimes it doesn't. And what we really have learned is that a more narrow range is sometimes required for different labs and a broader evaluation, things that look not just at your testosterone, but at your testosterone metabolites, or not just at testosterone and androgens, but also at cortisol, estrogen, progesterone, stress levels, nutritional workup, gut health. There's so much more to the picture. We are going to get into all of that today. My guest today is Dr. Rubaina Dang. She's a licensed naturopathic doctor, educator, and researcher in the field of integrative medicine, and her whole practice centers on that gut-skin hormone connection. She uses functional medicine testing, targeted nutrition, and evidence-based supplements to resolve the concerns that are often missed or dismissed in conventional care and workups, just like hair loss. Now, in addition to her clinical work, she also actively runs clinical trials and is a contributing author to continuing medical education series, and she speaks at conferences all over the country. Dr. Dang's a recognized voice at the intersection of hormones, gut, skin, and integrative medicine. I think you're going to really appreciate her perspective on the hair loss topic and really take a lot away, a lot of learnings. Let's go ahead and get started.
Thank you so much for having me. I'm honored.
I'm really excited to talk about today's topic because I think this is something that if you've been in practice and you work with women, it may not be the most medically concerning symptom, but it certainly is up there with the top emotionally concerning symptoms for women. That's hair loss. I think anyone who's experienced hair loss, even for a period of time, knows just how distressing it can feel. Can you talk a little bit about like what you hear from patients when they're coming into you with hair loss?
Hair is something that a lot of people, you think it's just, it's vanity, but it usually tells us something is going on even deeper. So most of my patients come to me and like you said, they're quite distressed. They're seeing their hair in the shower drain. They're seeing it on the pillows all over the floor, and they just don't recognize themselves anymore. The biggest thing is they feel like they're losing parts of themselves when they're losing their hair. And most often, women go to their doctors presenting with their concerns around their hair. They maybe get a basic workup like a CBC, a TSH, iron if we're lucky, and then they get dismissed being told that everything's normal. And they come to me and they're like, I am going to be bald in just a few months. I don't know what to do. And sometimes I get a referral to a dermatologist for, minoxidil, but usually they want to figure out why this is happening because they know, their hair well. They've lived it and breathed it their entire lives. And so when they're seeing it everywhere, they know something's going on and they just feel like no one's taking them seriously.
Well, it makes a lot of sense. I mean, it's obviously there are times where hair loss can be normal. We have this thing called telogen effluvium that happens like post-pregnancy. We'll talk more about that. And even then it's concerning, even when you reassure women that there's a reason why this is happening that's not health related. It's still very concerning. It's like, well, is it going to end? Because you're right. It is like losing a part of yourself. But then I love the fact that you bring up that sometimes it gets brushed off when it could be a sign of something else that's going on. We're going to dive into a lot of that today Before
Yeah.
we get into the specifics, how would you describe that gap between like what standard labs catch, like what do people get with their doctor, and what is actually driving hair loss for most of the women that you see? Like, what are the key buckets that you think about as a naturopathic doctor?
So, usually, when individuals, men and women, they go to their doctor presenting with hair loss, they maybe get a TSH, they'll maybe get an iron panel, ferritin if they're lucky, sometimes a vitamin D, and they usually get dismissed being told they're within range. And so, as a naturopathic doctor, we know that in range doesn't necessarily mean optimal either. And so I'm also looking for, what their actual values are. Is their ferritin that they got run, is it 12? Is it 20? Is it 50? Because that plays a significant role specifically with hair health. Same thing with a TSH. Usually they just get a TSH and they don't get a full thyroid panel done. And so I'm also looking for just kind of full upstream and downstream pathways because they tell us a story. And oftentimes we just get single snapshots of the story.
Mm.
And then, once we get the little snapshot, usually the patient gets dismissed and then they go home and they tend to do all of the research and they want more answers too. So it's my job to, hear my patients, listen to them, and get the full story.
I want to dive into all of these pieces because I think they're
Great.
so important. Women experiencing hair loss, they're routinely told like your thyroid's fine, your iron's fine. But I want where I want to start because I think you kind of got into this a little bit with ferritin is that the standard reference ranges are very broad and panels that are ordered are really narrow. But we know that, let's take thyroid for instance, hormones within the normal reference range, like for thyroid, can still be out of range for a specific patient, particularly with hair loss, like compared to controls. And there's nutrient deficiencies, like you talked about, ferritin as well. So, I mean, what we see is that this standard workup really just scratches the surface of a much more layered clinical picture. So, start me off or like help us all understand when you look at a patient's labs, everything's flagged as normal, but she's still losing hair. Where do you typically start? And what are you looking for that maybe that standard panel didn't capture? Or what elements are you looking at differently?
So I'll start with a medical workup. I always start there, So I'm looking at your CBC, your CMP, a thyroid panel beyond a TSH. So we're looking at a free T4, free T3, reverse T3, and antibodies. Antibodies get missed all the time, and they're some of the most clinically relevant information that we can get in women. And then we're looking at the iron panel, iron, TIBC, ferritin. And then beyond that, we're looking at micronutrients. So vitamin D, B12, zinc, selenium. And a part that gets missed all the time when patients come to me is they don't get their androgens or their hormones evaluated.
It's
So
shocking.
it's crazy, and
Yeah.
we know that androgenic alopecia is so significant, yet no one's ever had a testosterone free or total or DHT run. They've maybe had total testosterone, same thing if they got lucky, but free usually gets missed and DHT almost never gets run. And then I know we're going to probably dive deeper in this, but serum is so different than, looking at urine or salivary hormone testing too. And so because serum tells us more how much is what I like to say is how much is, bound to the protein in blood. It doesn't tell us how much is bioavailable and affects our tissues. And when we look at tissue health, specifically hair, we need to know what's happening at the tissue level. And so that's why serum testing isn't preferred for hormones when we look at hair health.
I think hair health is probably one of the most valuable times to run a Dutch test because of that very reason. I've always told Mark, our owner, I'm like, the tissue is the issue. Like when it comes to hormones, that usually the issues, and we think about this with like blood sugar, I think we understand that insulin resistance kind of comes before this elevated blood sugar that we see, or even elevated insulin in the bloodstream. The bloodstream is kind of the last place that changes, but the cells, they adapt more quickly. And I love that you're bringing this up with hair health because I think we've really tried to optimize the Dutch test to be able to evaluate that because we have a marker for biotin and things that we can pick up in the urine. But can you talk a little bit about androgens? I think this is the androgenetic alopecia is a huge cause. And I completely agree with you. Running standard blood work could probably be missing a huge number of women who are affected by that.
So androgens is key here because androgens affect both men and women. And first of all, a lot of women don't think that they have androgens and they're like, what? Women have testosterone? And, testosterone is vital for women. We need it for libido, we need it for energy, we need it for bone density, muscle mass preservation. And so some women think testosterone, generally isn't a good thing. So when we run the Dutch test specifically and we look at their testosterone and the metabolites, specifically DHT, what I let the women know is testosterone is healthy, but we're looking at the downstream pathways. We're looking at the 5-alpha reductase pathway because when it comes to hair health, we actually have receptors for 5-alpha reductase in the tissue and in the hair follicles as well. And so what 5-alpha reductase and DHT does specifically for the hair is it causes miniaturization. It makes your hair follicles and your hair strands thinner and thinner over time. And so usually women who have higher levels of DHT or androgens in the tissues, specifically in their hair, they remember and they look at photos from decades ago and they're like, I used to have such thick hair. I don't know what happened. It's thinner and I just feel like I have half the density than what I used to have before. And so that's why androgens play a significant role. And a lot of, individuals also come to me and they're like, oh yes, I have a family history of hair loss. It runs through the family. But what that means is we can see these patterns of we could be more genetically predisposed to having higher, DHT and androgens in the tissues. And so the earlier that we recognize it, the earlier that we can start to do something about it as well.
Yeah, and what that means clinically for those of you who are listening who are patients is you could have the same testosterone, free and total testosterone, as the person sitting beside you, but have a very different effect at the cell level, at the follicle, because of how you metabolize it. And with the Dutch test, we do measure that. We actually put out a white paper. I'll make sure we link to it in the show notes for those of you who are interested, particularly clinicians, because it is science heavy. But there's a lot of research on a marker called 5-alpha androstenediol, which is a downstream metabolite of DHT, what Dr. Dang's talking about here. And DHT doesn't leave a cell very efficiently. It kind of stays inside of the cell. If it's high in the bloodstream, it's really high in the cells. But 5-alpha andro does leave, and we can measure that in urine. And there's so much research, clinical research, on how it can distinguish women who have clinical symptoms that show up due to androgens, not just with hair loss, but acne and PCOS, PMOS, and a lot of other things. But I love that you explain that because I think it's such an important piece. And it's one of the big reasons why we miss androgen-related hair loss in blood work.
Absolutely. I think it goes missed almost always in standard blood work. And that's why the importance of Dutch comes in because, most women, they've come to me with their labs and, there are some providers that do run more comprehensive labs, but things do get missed. And what I think is also very unique about Dutch too is because we can look at the metabolites and you can't look at metabolites on standard lab panels. And so that's where Dutch really, I would say is my first point of contact when it comes to testing for any of my hair loss patients.
Well, we love to hear that. Thank you.
Of course.
I want to talk not just about androgens because there's other hormones that can affect hair as well. Let's talk a little bit about cortisol and the role that cortisol and stress hormones have. What happens when kind of chronic stress triggers your hair shedding? Can you talk a little bit about that?
Absolutely. So what stress does, specifically cortisol, is it prematurely shifts your hair from the growing phase, which is called anagen, straight into telogen, which is the active shedding phase. So you can have different types of stress and cortisol. You can have acute stressors, you can have, chronic stressors, versus like acute cortisol versus chronic cortisol. So in more of an acute situation, so let's say a trauma, a passing of a loved one, something, a breakup, something significant, you can go through an acute stressful period and that can prematurely shift your hair into telogen phase. Or you can go through chronic stress for months, for years, for decades, and that can keep the hair in more of that premature telogen phase. So what that means is your hair doesn't stay in the growing phase very long. It might stay in it for a little bit, but then it'll prematurely shift into telogen. And when that happens, it could be called telogen effluvium. So it's more of the significant hair shedding. But here's the important thing is telogen effluvium usually comes on 2 to 3 months after the stressor. So most women, when they're presenting in office, are like, my hair's shedding, but I don't know what's going on. Like I just quit my job, or I just, I don't have that much going on in my life. And then I ask them the question, what was going on in your life about 2 to 3 months prior? And that's usually when they're like, oh yeah, I went through this significant thing. And I tell them that there is this, 2 to 3 month waiting period. And in this waiting period, also called catagen, the transition phase, the hair is getting ready to shed. And so that's why we don't see it directly. And when it comes to stress, we get exposed to stress in our daily lives. And some individuals come to me like, I can't stop being a mom. I can't stop being stressed. I don't know what to do. But we talk about the importance of how cortisol can directly influence hair health and the importance of supporting their cortisol and supporting their nervous system. And testing it is a big part of that as well.
Yeah, it's interesting because I think stress is very rarely only one thing. It's like an overflowing bucket, and it's not usually just one drip or one faucet. You might not be able to stop being a mom,
Yeah.
but you can definitely, go for a walk every day or try to get better sleep or things that help you kind of maintain that. It's really interesting because I think about, the times that people have come in my office with hair loss, predominantly it's like that time frame, 2-3 months postpartum is such a big one. Can you talk a little bit about that? Because I think there's so much happening at that time, from the physical exertion of a birth to the stress of becoming a new parent to humongous hormone changes with estrogen and progesterone really dropping. That seems to be one that's worth talking about specifically.
Oh, it's so important. Especially postpartum, what happens is your estrogen plummets, and estrogen is very protective for hair health. So estrogen keeps our hair in the anagen phase, which is the growing phase. So suddenly we deliver, estrogen plummets, compounded by, especially first time, or not even first time, second, third, fourth time mothers, just the cortisol, they're not sleeping, sleep is disrupted. So the cortisol usually tends to be elevated. Progesterone hasn't fully kicked in, so there tends to be more of a progesterone depletion too. So these women experience a significant rapid shed, and a lot of the postpartum women, they notice it in the temples. So they have the postpartum shedding specifically there, and that usually is a sign more of that estrogen drop off too. And it could be compounded with the telogen effluvium. So most of these women, they tell me that I can't change anything. And so that's where we focus more on supporting, micronutrients through food. So I said the one thing that we can control is making sure you are well fed and that, you're getting nutrient dense foods in, because they're usually breastfeeding, and breastfeeding also is just so, nutrient dense for, mothers. And so they need a lot of nutrients to support their babies. And so I say, even if we can add in some breathing exercises, even if we can add in short naps throughout the day, walks, like you mentioned, some sunshine, little changes that will help move the needle overall in the long run.
Yeah, they're little things, but they do make quite a big difference, especially when you can do it more regularly. The other thing that I always love to remind my patients of when it comes to that postpartum shedding is that pregnancy keeps your hair in a growth phase with all those hormones. So not only are you losing, but you also almost have more to lose because your body kind of catches up with what would have normally been shed during pregnancy. So it can seem even more extreme in that postpartum shed. It's very unsettling for almost everybody, I think, that goes through it.
Absolutely.
We'll be right back with more. At Dutch, we empower providers to confidently integrate functional hormone testing into their practice. Registered Dutch providers gain exclusive access to hormone education courses, including our Mastering Functional Hormone Testing course. This course shows providers how to effectively use Dutch testing to assess and interpret hormone levels in both male and female patients. You'll learn more about hormone testing basics, including estrogen, progesterone, and androgen levels, as well as adrenal function and HPA axis health. Register for this course on the homepage of your Dutch provider portal, or become a Dutch provider today to get access. Welcome back to the Dutch podcast.
I want to talk a little bit more about some of the other hormone factors. We talked briefly about thyroid, and obviously thyroid is a really critical part of the conversation around hair loss. Can you share a little bit about, let's talk about testing and ranges when it comes to hair loss? Like what, because you said most people run a TSH, but that can be incomplete. What would you run that's different or expanded beyond TSH? And then I'd love to hear you talk a little bit about what you view as an optimal range for women, where you can really rule out thyroid's not a piece of this, where there's obviously kind of a squishy zone in normal but not optimal, where you're thinking, okay, I still need to figure out if this could be part of the picture.
Absolutely. So we always start with a TSH, a free T4, a free T3. I like to get a reverse T3 and those antibodies. And so usually women come in, they have their TSH run, maybe a T4. So once we get the whole picture, we're looking at the whole pathway from, the brain communicating to the thyroid gland and the output of the thyroid hormone too. And if there's any inflammation and autoimmunity against the thyroid gland with the antibody. So this is what I usually see in practice if there's a thyroid related concern. These women tend to have TSH values that are either on the upper end of the normal range or slightly out of, the upper threshold of normal. So this can look like a 4.85, a 5.2, and they've been told by their doctors, oh, it's normal, or, your TSH is trending a little bit, but we don't need to do anything about it. And they often can have a normal free T3 and free T4. So this can put them in a subclinical hypothyroidism. And I tell my patients, our hair health is directly connected also to our metabolic and our thyroid health too. And so that's why it's so important to have our TSH within more of an optimal range. And so I know you asked for just kind of my preference in terms of lab values. I like the TSH to be under 2.5. So let's say like a 0.8 to 2.5 is my preferred range. Anything above that, it's telling me the thyroid definitely does need a little bit more support. And for the cases of individuals that have a completely normal TSH, a completely normal free T3, free T4, reverse T3, but elevated antibodies, I also take that very seriously because for me, elevated antibodies is a warning sign. There's definitely some inflammation, autoimmunity against the thyroid gland, and that can directly impact hair health too. And so we want to support and understand why are the antibodies elevated. And that can sometimes just be, what hits the nail on the head is once we get the antibodies under control, the hair, usually is reflective of that too. So sometimes thyroid health goes missed when it comes to hair health, but just looking at things from more of an optimal range and getting the full picture moves the needle significantly.
Now, let's talk a little bit about ferritin now. It's another marker that you had raised, really, the first question that I asked you. For listeners who might be new, can you talk a little bit about what ferritin is and why it's important to measure for hair evaluation?
So ferritin is our iron storage. And it directly supports hair health and hair, I call it it's nutrients for our hair. And so usually if women get their ferritin measured, the reference ranges can be different depending on different lab testing. Some consider ferritin normal at 12 to 15, nanograms per milliliter. And so they go to their doctors, they get their ferritin is maybe 15, maybe 12, maybe 20. And they're like, oh, my doctor said I don't have anemia, I'm okay. And I specifically asked for the number. I said, what's the number? And they, usually tell me their number. It's on the lower end of the range. And I let them know that ferritin is what, our hair follicles need. And so they're directly pulling iron from our ferritin. And for our hair health, we need it to be at a bare minimum of 50. Minimum, but ideally closer to 70 to 80 for optimal hair health. And in reproductive age women, most of these women are walking around with ferritins, under 10, under 20, and wondering, same thing, why they're exhausted, why their hair is falling out. And once we focus on increasing iron-rich foods, potentially, focusing on supplementation and getting that ferritin up, they notice so much more stability in their hair health. And so ferritin is one of the markers that is directly supportive for our hair.
It's so important to be thinking about that. And actually, this has been really in the news lately because they're looking at raising the bottom end of the normal range for ferritin to be a bit higher. What do you consider to be like problematic or like low normal, where you'd start to say, okay, I'm actually a little worried about this?
Anything below 30.
Yeah, I'm about the same. I think 30. One other consideration that I think is really interesting is HSCRP has a relationship with ferritin as well. Like when there's inflammation, it basically, your ferritin can go up with inflammation. And so it can look okay when it's really not. And there was a study, I'll send the link to in the show notes here, like a pooled analysis of about 25,000 women, when they found that iron deficiency was dramatically underestimated when ferritin wasn't corrected for inflammation. As CRP went up, the like relative prevalence of depleted iron stores dropped from about 29% in this population to only 6%. So that wasn't because iron status improved, it was because inflammation was raising the ferritin falsely. So that's another thing just for clinicians to be thinking about, is if CRP is elevated, you have to be considering that the ferritin might look higher than it is, and you might actually still be dealing with iron deficiency. A lot of people are running both, so I'd love to always throw that in there. It's good to know about. Now, are there anything else? You'd mentioned a lot of the nutrients as well that you like to check on. Are those ones that you measure directly in the blood, or do you measure them through a different means?
So this is where I talk to my patients about their means too. I want to always meet the patient with where they're at in terms of testing. So I'll start with serum testing, vitamin D, B12, zinc, magnesium. I'm trying to get, as much information I can, but it's not always accurate and reflective what's happening intracellular. And so I tell them, we can get a serum level, but it doesn't mean what's happening, in the cells at the tissues. And so if we're going beyond that, other things that I'd like to evaluate is micronutrient testing. So with micronutrients, we can get a much better idea of, their overall status of their nutrient health. And then I also sometimes run organic acids in certain individuals too, because it can also tell us about our, amino acid profile. It can also tell us so much more about other things that are impacting our tissues. We can see put in certain organic acids or heavy metal testing if there's any heavy metal interference, if there's any mycotoxin interference too. And so once we get a much better idea, I've had many cases actually where individuals have come in with, beautiful Dutch test results, nothing significant or minor tweaks to focus on, serum testing normal, and we do an organic acid test or heavy metal test, and we see significant disruption there. And so what I usually tell individuals in those cases is basically, nutrients are fighting for in the hair follicle, they're basically fighting for their spot there. And oftentimes heavy metals and mycotoxins can block absorption of nutrients coming in too. So once we eradicate those and get those out of the tissues is when we can finally absorb and support our hair health.
It's such an interesting thing for you to bring up, particularly with the toxin side, because is there a lot of data on whether toxin exposure affects hair growth and hair loss? That's not something that I've really looked into.
I wouldn't say there's a lot of data, but there is some data out there. And so, the main data that we look at is aluminum and mercury. And those can interfere with absorption. And so we look at, are they intracellular? Are they, basically preventing absorption? Are they, systemic? So that being said, you want to just support, that's where I say, let's get the liver support. Let's remove the source of where you're getting the exposure from. And some people, they have, dental work done or they have, certain implants and then they can't remove it. So we talk about how do we support just overall detoxification of the body.
That's great to know. One of the things I've thought about a lot lately, and this is, I don't know if you've seen this in your own practice, but a lot of patients who go on GLP-1 medications and they have this great weight loss, which is what they're looking for, they're seeing that essentially a telogen effluvium a few months later. Or hair loss, a few months later. And it's really interesting to think about the mechanisms that are driving that, because you have rapid weight loss, which in and of itself could be a stressor, or the caloric restriction associated with, just eating less food and a reduced appetite could be a trigger stressor or could cause nutritional deficiencies. And, we store our toxins predominantly in our adipose tissue. So I've thought a lot about that too, where as you're losing weight, all of those stored toxins become mobilized again. And it's gotten me thinking about how complex it must be to try to unravel the cause of that hair loss that's associated with GLP-1 use. Is that something that you've seen in practice or worked with patients on recently?
So much. I can't even begin to tell you how much.
Okay, let's talk more about this. This is interesting.
This is a great one. So usually what I see is individuals, and it's not initially when they start a GLP-1, it's usually 3, 6, 9 months in. And so they've gotten to a point where they're happy with their weight is plateaued, but they're like, oh my gosh, my hair will not stop coming out of my head. And so what I tell them, we go through a full 24-hour diet recall. What are you eating? And at this point, they tell me, okay, maybe a protein bar for breakfast or protein shake, a salad with a little bit of protein, and, maybe some pasta or I don't know, something for dinner. And I tell them, while you're losing weight, we're also losing muscle too. We need to support, that protein consumption in. They're missing out on a lot of key micronutrients on GLP-1s. And when the body goes through significant weight loss, that is very stressful. So in a way, it's contributing to telogen effluvium. Then we're compounding that with potential micronutrient and protein deficiencies. And when the body goes through, significant weight loss, it is alarming for the body. And so that can contribute to the body's trying to recalibrate. And it's not going to focus on, creating new hair when it's trying to survive and trying to understand what's going on with the rapid weight loss. And so the hair gets pushed to the side. And so there's a cortisol component there. There's a micronutrient component there. There's potentially, like you said, the toxin mobilization component. So I said we have to address it, focusing on diet first, making sure you are, nutrient dense, and then focusing on, supporting reducing cortisol, even though these individuals are like, I actually feel like I'm less stressed now that I'm not having that food noise. And so that's when the Dutch can come in handy too, is we can look at their diurnal cortisol and see what's going on. And usually in these cases, they either have elevated cortisol, elevated 24-hour cortisol, and difficulty with metabolizing it. And that's something that I always point out when people have, lower just kind of metabolized cortisol is the cortisol has nowhere else to go. So it's going to stay metabolically active in the tissue. And so that's why it's important to add on the adaptogens and adrenal support to help with, mobilizing and supporting, just regulation of cortisol.
I love that you're looking at this so comprehensively. Let's talk a little bit more specifically about Dutch testing. So you've brought this up a couple of times. When you're looking at a Dutch report for a patient with hair loss, can you walk me through what areas of the report you really hone in on first, second, third?
Yes. So the main areas that I focus are cortisol. So I want to see what does their diurnal pattern look like, and is it elevated? Is it flatlined? Because those two have very different approaches. And like I mentioned, their metabolic, activity of how well are they metabolizing their cortisol. The reason I start with cortisol is because cortisol really is the trigger for the rest of the pathway. And so if your cortisol is dysregulated, your hormones are going to be dysregulated, most likely too. So we start there. The second place that I look at is the androgens. And so just like how we've been discussing today, androgen activity is so prevalent at the hair tissue and just at the follicle level. And so I want to see what is their 5-alpha reductase pathway, encouraging in terms of the metabolites of DHT, and also just kind of, is there just more do we need to support that pathway more generally too? And so we can talk about that with patients. And then I look at their estrogen levels and their estrogen metabolites. And so I want to see, is there any concerns around low estrogen? And some women can have, lower estradiol, but have higher metabolites. So we can talk about, are we detoxifying them? Are we, supporting just overall, are we supporting their estrogen levels in more of an optimal way? And then I also go ahead and look at progesterone, because we look at the ratio of estrogen to progesterone and see, are they aligned? Is someone, having more estrogen dominance due to progesterone insufficiency? Then we kind of go down into more of the organic acids that are run. I like looking at the biotin. I like looking at their neurotransmitters. I like looking at, glutathione support too. So I'd say all of it plays a role, but sometimes let's say a patient comes in with a report that everything's off, their cortisol's all over the place, their estrogen's higher, progesterone's low, DHT, and androgens are elevated. They feel overwhelmed. They're like, are we focusing on all of it?
We call that hot mess, right? Well, I'll call it to myself. But if my report looks like that, and it has, that's when I say I'm a hot mess.
And it happens. And it happens all the time.
It happens.
It does.
Yeah.
And I say it's so important to go in a step-by-step fashion because it can be really overwhelming for a patient when we start to focus on everything. So I say, let's start with what's most concerning, and it's usually cortisol because that impacts the whole pathway. And then I start with androgens because androgens, they move slowly, it takes at least bare minimum 3 to 6 months to start to see changes when it comes to androgens, especially at the scalp level. So I will almost always start there. And then we'll move to supporting estrogen and progesterone as needed. Same thing with detoxification. If we need to add on that support too, same thing with micronutrients. So it kind of goes in a stepwise fashion, and people usually don't feel overwhelmed when we do that.
I really like that approach because you're right. You can't just throw everything. You also then don't know what's working or not working. And if the patient's spending money on things they don't need to yet. But we think about that a lot. Like cortisol is, if you think about all of our hormone systems, cortisol and then I would say glucose, like our just base metabolism, they're the base of that like endocrinology pyramid because they affect everything upstream. If your cortisol is off, it changes the way you metabolize androgens. It affects production of progesterone and estrogen. And even at the tissue level, it changes how your cells use hormones. So I love that you tackle that first. It sometimes feels like it can be one of the hardest things to help patients fix, particularly when they come in saying things like you mentioned before, like I can't quit my job. I can't, move to Bali. We all wish we could. That'd be great. There's of course other stresses associated with that, but it's so important to try to get a hold of it any way that you can, because then you're not just chasing, it's like whack-a-mole where you have a hormonal issue that pops up. Like cortisol is actually fixing the root problem.
You bring up a really interesting point that almost nobody's talking about too, is the importance of blood sugar regulation in hair health.
Well,
And
let's talk about
so
it.
Yeah, so this is something, we can actually evaluate to see if there's any sort of insulin resistance and how our blood sugar impacts our hair health. So if we're going through periods of crashes in terms of our blood sugar, that can spike and elevate cortisol too. And so for instance, individuals, let's say they're snacking all day, or they're eating just more carb-rich foods, or, not getting adequate amount of protein, the continuous blood sugar spikes and crashes can signal to the body that, it can increase cortisol, and it can just overall lead to more of that chronic elevated cortisol picture too. And so in doing so, that can trigger the hair to go into telogen effluvium as well. And so just like you mentioned, there is such a strong component between blood sugar and cortisol that gets missed all the time.
It's important to be thinking about, and we know also that when there's metabolic dysfunction, we see changes in how the cells utilize hormones as well, like including the 5-alpha reductase enzyme and how well that works. So it's really important to make sure that that is a good foundational baseline. So definitely is super important. I want to talk about another area that I love that I've heard you talk about, and I love that you bring this into the picture. And that's like that gut, skin, hair connection. And you've talked about that being almost like a missing piece. And of course, we know like our hair follicles need a steady supply of nutrients, and those nutrients come by absorption from our food. And so if there's gut dysbiosis, it could impair that absorption, but also probably drive inflammation. So can you talk a little bit about, obviously this is a whole world of like microbiome health and how the impact of the microbiome is affecting, I can't think of a bodily system that it's not affecting. Tell us more about like, what do we know about the microbiome and gut health in hair? And obviously I'm sure there's still some gaps of research that you wish we could figure out more quickly.
Absolutely. This is an area that almost nobody's talking about, the importance of gut health and hair health. And what we don't realize is our gut health is essential. It's crucial because our hair is one of the most nutrient demanding tissues in our body. And if something's going on in our gut, let's say there's inflammation or dysbiosis meaning overgrowth of harmful bacteria, we're not going to be absorbing our nutrients as effectively as we should be. And so in doing so, you could be eating the most nutrient dense, let's say your grass-fed meat and all of your, local produce, and you could be eating really wonderful nutrients, but you might not be absorbing them if something's going on, in the gut. Same thing, we have our digestive enzymes. And so many individuals have, just insufficiency in enzyme activity, meaning they don't have enough support in breaking down fats or proteins or carbohydrates. And this I see in stool tests all the time. And so they're same thing. They're eating all of this, great food that is very nutrient dense, but they're not breaking it down and absorbing it correctly. And so because our hair is, so nutrient dense and needs a lot of nutrients to help to support it, specifically amino acids, if something's going on in our gut, then we're not getting, everything that we're consuming. So I say, for the individuals who we've done the work, we've looked at, their micronutrients, we've looked at their hormones, we've done the standard medical workup, and, they still feel like, they can't really move the needle, or if they're also presenting with bloating, with, changeable bowel habits, with abdominal pain, I always add on comprehensive testing and gut microbiome testing to those patients in those workups, because it can tell us so much. And something that you mentioned is the word inflammation. So we can have inflammation, and that can contribute to intestinal permeability. And intestinal permeability, basically what's happening is you're eating a food, you're mounting an inflammatory response in the gut, and when in intestinal permeability, you're having a little bit of a leaky gut. It's passing through the bloodstream, it's going systemic, and then where does it go? It can contribute to inflammation directly at the hair follicle. And that leads to something called alopecia, specifically alopecia areata. And so, we're having this, systemic inflammatory reaction from something that's, potentially starting in the gut. So people don't make this connection often. And so that's why it's important to, also evaluate for other symptoms, fatigue, joint pain, digestive health, bloating, constipation, diarrhea, and getting a much closer evaluation, because, sometimes dysbiosis could be the thing that's impairing the absorption of nutrients.
Yeah, I love the approach that you take. And I think this is like one of the reasons why it's so great to see a naturopathic doctor when you have a symptom like hair loss, which might seem straightforward or might seem like I'll just go to the dermatologist or I'll just get on minoxidil. But usually these types of symptoms are reflective of something happening internally. Like skin and hair are just such a big, we always say it's like the window to the gut, right? The skin and the hair. So, or it's just the window to what's happening inside. So I love the fact that you take such a comprehensive look at a symptom like this, because I think ultimately, and this is, I guess, is the difference of this type of approach, is that you're not just trying to stop the hair loss. You're trying to get to the reason why it's happening, because, as we know, symptoms start to whisper, but then if you don't listen, they get louder and louder and louder and a little bit more dramatic. And that's what we want to try to avoid.
And that's a great point, because with our hair, it's usually it's like a very quiet whisper initially, and then the whisper grows, and then it becomes a yell and a scream, and people really start paying attention, when it's that yell and that scream. So I'd say with our hair, it's important because it tells us our hair is a reflection of so much that's happening. As we've seen in this conversation, it can tell us about, hormones, it can tell us about our gut health, it can tell us about, our stress, it can tell us about so many different things. And so that's why, especially for practitioners and providers who are listening, to really take patients seriously when they're presenting with this, because it is extremely distressing and it tells us so much about, where to look next.
I want to shift gears a little bit to talk about what do you do about it. So obviously it depends upon the root cause. Like if it's hypothyroidism, you would get the patient on thyroid medication, or, you have to address whatever root cause comes up. Can you share some of your top support that you utilize for hair loss or hair growth? And I want to then kind of give you that ping fast, like what would you rate it on a 1 to 10 scale for a lot of the things that I'm seeing promoted online?
Oh, I love that question. Okay.
Okay,
So
we're gonna have some fun.
Yeah. So I'll start with just overall, let's start with just medical, we'll make sure optimize the thyroid health. Let's say they have, a sluggish thyroid output. We can support it with nutrients. Selenium's great, Brazil nuts. I love to use food. Same thing with ferritin. If an individual has a ferritin below 30, we are absolutely supporting through food, but we're definitely supplementing as well. And then beyond that, I love to for cortisol. It depends if it's more of an adrenal, like, they're mounting excess cortisol. I love holy basil to just really help to downregulate that. And then for those who are having more of a flatline cortisol, they're just chronically exhausted, wired but tired at night. I love to add on rhodiola, just, eleuthero, magnesium, just to really help to support just overall the cortisol rhythm, as well as if there's any concerns around insomnia. Magnesium's my go-to.
Cool.
And then let's move to androgens. So let's say someone has higher androgen activity at the scalp with that DHT, 5-alpha reductase. Saw palmetto is great. Pumpkin, I love pumpkin seeds, and spearmint tea is foods to incorporate because I think foods are fabulous to add in. And then let's say, there's concerns around estrogen, detoxification, low estrogen. We can add on some phytoestrogens such as maca, black cohosh. In my reproductive age group, I love to add on shatavari as a great phytoestrogen supportive agent. Same thing if progesterone's a little bit lower, Vitex, B6 are wonderful. And then let's say we're kind of continuing to move along to gut health, for gut microbiome and inflammation. I like to make sure we eradicate any dysbiosis. And this is something that goes missed often, is healing the gut after, reducing the inflammation. So going on a gut healing protocol with zinc carnosine, potentially some aloe, L-glutamine, just really helping, I love immunoglobulins, colostrum to help to support gut health. And then same thing, micronutrients, making sure vitamin D is optimized. We haven't really talked too much about that, but vitamin D plays a significant role. B12 plays a significant role, especially for those who follow more of a plant-based diet. And then a non-negotiable in all of my patients who are coming in with hair loss is making sure they're eating enough protein. I would say you cannot, amino acids are the building blocks of our hair. And so if you're not getting enough protein, you're not going to be creating new hair. So you need to get at least bare minimum, if you're not an active individual, half of your body weight in grams of protein, but we're looking closer to 100 plus grams in most cases.
That's such important advice. You need the building blocks in hair. I mean, I'm sure people have noticed times in their life where they're eating healthier versus not. The quality of your hair changes as well, not just whether it stays attached to your head. So it's definitely such an important thing. All right, let's go through. I want to talk about some of the things that I'm seeing. This is on the spot too. I'm putting you on the spot
Great.
here.
Let's do it.
But I want you to rate them like 1 to 10.
Okay.
And then tell me why. Okay. So I have a whole list. So I would say protein powder, number 1. These are all the things I'm seeing marketed online for hair loss. Protein powder.
Okay. So my question for you, are we doing whey or are we doing plant or both?
You tell me. Is there a difference?
I would say, so whey, there is a difference, and I'm going to go through it. So whey has a higher concentration of proline, leucine, and lysine over plant, but here's the caveat, is it's much more inflammatory. So, it could be supporting hair health in some individuals, but it could be contributing to more of an inflammatory load in others. So usually what I do is I do like protein powders, but I like them when they're usually plant-based pea protein, and then they add on amino acids to it for a full profile. So
Awesome.
If I can rate it, I would say it's not my first go-to, but to help with incorporating more protein, I give it an 8 out of 10.
8 out of 10. Perfect. How about collagen? I mean, I see some collagens too that are so expensive, but women report that it really helps with hair loss. So how would you rate collagen?
Collagen's a good one. So collagen, there's there's different types of collagen. We have our bovine versus our marine collagen. And for hair and skin health, you actually want marine collagen. It has that higher concentration of that, that leucine, lysine, proline that I mentioned over the bovine. So I said collagen's great, but it's going to help with supporting new hair growth. It's not going to get to the root cause of why your hair is shedding in the first place. Caveat, especially for those who are over the age of 50, gone through menopause, we have that whole estrogen component too, but there is that significant collagen decline as well. So in that population, I'd say 50 and up, collagen is essential. Same thing, I'm going to give it a good 8 out of 10.
Cool. I've also seen that Aminomar marine complex. I think it's under the brand Viviscal. Is that something that is that a collagen base? Is that a marine collagen?
I don't think I'm familiar with it.
Okay. All right. We'll skip that one. How about a multivitamin?
I think multivitamins are great, but I think we should be really focusing on getting our nutrients from food. So I'd say a multivitamin, I'm going to give it a good 5 out of 10, but I like to look at specific nutrients that people need and replenish specifically what they're deficient in.
Awesome. How about biotin?
Honestly, I don't like biotin. I don't think
This is why we're asking. We're asking the experts. Okay, let's talk about a hot take.
I'm going to give a biotin a good 2 out of 10. And the reason and the evidence only shows that biotin supplementation helps for those who are biotin deficient. Yet we're pumping all of these hair growth supplements with biotin when most individuals aren't deficient, and then it interferes with thyroid testing. And so I would say, biotin doesn't harm you in terms of taking it, but it's definitely not going to move the needle.
I'm glad that you bring that up because biotin does interfere with some lab tests. Vitamin D is another one. You mentioned thyroid. So there can be interference with other hormones too. So if you take biotin, especially higher doses, like in a hair support product, you want to stop it a few days before you get any blood work done just to make sure it doesn't interfere. And then the last one I want to ask you about is minoxidil, because a lot of women want that instant effect. Do you ever use that in practice? How would you rate it, topical or oral?
I rarely use it. And the reason why is I tell my patients, once you start minoxidil, it is a lifetime sentence. You are not stopping it. And consider that. Are you willing to add in minoxidil like you brush your teeth every day for the rest of your life? If you start it, it is great. What it does is it keeps the hair in the anagen growing phase. But the moment that you stop it, the hair is going to revert back to what it was before you started it. So it's really up to the patient on can they commit for the rest of their life. If they can, really great, wonderful research, wonderful benefit. But most of the times, and I'm going to say maybe 90% of the time, they don't want to take something that's going to impact them for life or that they'll have to take for life. So I would say it has ability to be a 10 out of 10 if you want to commit to it, but the realistic part is most people don't. And so it's just kind of a temporary Band-Aid and they want to get to the root cause of it. So I'm going to put it at a good 6 out of 10.
Okay. I've loved that. I've learned a lot. It's been super helpful to go through those. And is there anything else that you're seeing marketing online that you would just say, if you're listening, don't waste your time with this?
I mean, there's just so many there's so many companies out there that are just kind of marketing as hair growth, hair supportive, but they haven't done the research. Can I talk about a company that has done research?
Sure.
Great. I'm pro Nutrafol. And so the reason I'm pro Nutrafol is because they have put their products to clinical trials. They do have different supplements for different, individuals, meaning there's a postpartum formula, there's a woman's menopause formula, there's a vegan formula, they have formulas for men too. And so the reason I like them is because they target the key root causes as to why most individuals do experience hair loss. Not all, but they have been shown to be clinically safe and effective. And they actually have a study coming out very soon talking about GLP-1 use and the use of Nutrafol concurrently. So that's something that's really exciting coming up. So I would say, look into products that have clinical research and studies behind it too, and that just aren't making these, claims based off of, a few individuals who've tried it. And definitely look at the safety profile, because sometimes it's really just biotin and maybe a vitamin D. Maybe it's just a very expensive multivitamin.
Yeah, with a different branding. I mean, that's so good to look at. I think it can be so tricky for someone who's new to using dietary supplements to read a label to understand, is there value in this or not? And I think as NDs, we could walk through Whole Foods and tell you there's probably 30 products that are all substantially the same that have different branding. One's for focus, one's for relaxation, one's for hair. They're fundamentally the ingredients are not different enough to really make a difference. You have to really know what you're looking for.
And then lastly, therapeutic dosages. Sometimes some formulas can have great nutrients, but the dosages are, just so minuscule. It could be let's say we're getting zinc in there. It could be 2 milligrams of zinc, or let's say there's a little bit of vitamin D in there. You're hardly getting 500 IU, of vitamin D. So that
50 milligrams of vitamin C, you're okay, yeah, that's not enough to, it's like walking by an orange, it's not even consuming.
Exactly.
There's so little in there. Yeah, I love that you bring that up. Well, this has been so helpful. I think it's really important. And my biggest takeaway is that having a good evaluation is really critical in order to understand what's behind hair loss and to make sure that you're treating the root cause. And secondly, my other big takeaway is that if you've been told everything's normal, everything's fine, you might want to work with someone like you who has a lot more of a depth in understanding that normal is not always fine. Normal on a lab is not always fine.
Yeah, I always tell my patients, don't ever let anyone gaslight you into thinking that, your symptoms are normal, because you know your body better than anybody else. And if you think something is wrong, most oftentimes there usually is.
Definitely. Well, I really appreciate you joining us today. If listeners want to learn more about you, what are the best places for them to connect with you?
So I have a website, www.healwithdrdang.com, and then social media is Heal with Dr. Dang as well.
Fabulous. Well, thank you so much for joining us today. And thank you, listeners, for joining us today, too. Hopefully, you learned as much as I did from Dr. Dang about hair and about really the way that we can better understand what's happening for each individual person. If you love work like this, you love podcasts like this, you want to learn more about hormones and health, just a reminder that we release a new podcast every Tuesday. You can subscribe anywhere that you're streaming us right now, and make sure you follow us at Dutch Test on all the socials as well. I will see you next Tuesday.
Thanks for joining us on the Dutch Podcast. Join us every Tuesday for new conversations with leading functional health experts. If you like what you've heard, be sure to like, follow, and subscribe wherever you get your podcasts.